Hi everybody, Dr. Paul here. We're going to do another Q&A. This is Labor Day weekend. This is Q&A number 4. We're going to have a 30-minute session. So feel free to throw your questions at me. I want to preface it with one thing. I'm a doctor. I cannot diagnose and treat you on this format. So any responses I give are just in generality. Obviously, check with your doctor. And I have to go fast because there's so many things coming that I'll do my best, but it'll be quick.
What's going on, guys? It is Noah, Big No-No, Dr. Paul's producer. I just wanted to remind you guys that if you want to make sure Dr. Paul does not miss your question, use that super chat function, support this channel, and have one of the top pediatricians in this fine country give you one-on-one attention. Otherwise, we'll answer as many questions as we can. We're really grateful that you guys are here. Okay, so we have a bunch of people just saying hi, like a ton of people.
Hi, everybody. I'm glad to have my producer back with me. Those of you who checked in when I was at the Eclipse at the coast doing it solo, that was no good. No good.
Okay. Let's see here. Let's get us cracking with a question. This is a silly one, but who cares? Jersey Peterson, what emoji do you like the best?
I do a smiley face the most, and next would be a thumbs up.
Beanie would like to know, what is your hardest patient?
Hardest patient. Well, my wife helped me out after the last 2 sessions when I couldn't answer that question. I used to work in the field of child abuse, and I have to go and evaluate kids who had been sexually abused. I had one case where the child was abused and murdered. That was beyond tough. So tough that I'd actually blocked it out of my mind. She had to remind me. That's especially tough when kids have been abused.
Warrior Dino says, do you have a pet? Question mark.
Do I have a pet? Was always a dog person. Most recently, we have 2 cats, and I've come to really adore them. So yes, I'm now a cat person.
Ella Crouch, I love, what's your favorite music?
Favorite music? Wow. You know, in college, it was disco and R&B. I still enjoy R&B. And I don't even mind most of the pop songs. I have a hard time with rap if the lyrics are, you know, harsh. Other than that, I actually even enjoy that. I like a good beat.
Sarah Yan, I want to ask you about your specialty in pediatric. How was your experience?
So I love pediatrics. When I was in training, I thought I was going to do family practice where you take care of all age ranges. Dealing with older adults, especially those who are like trashing their health with smoking, drinking, and then of course not telling you the truth about what's going on. I found that frustrating. Dealing with kids, they're just so honest and open, and their parents want the best for them. It's been a great fit. I love kids.
Angel2221 asks, Doctor, what do you do on your free time?
Hi, Angel. Well, this morning I just went to CrossFit. I had the day off today. I love exercise. When I get a rare moment to do this, I love to ride a motorcycle, windy roads, nice weather, doing it safely. Just totally relaxing for me to be able to just sort of let the wind blow in your face and just take in the whole scenery.
Maria Elena Gonzalez asks, how can someone combat anxiety and panic attacks?
So Maria Elena, depends, and a lot of people are struggling with anxiety these days. It is unbelievable how many of us are struggling with it. I would say clean up your diet first. Make sure you're getting enough sleep. Those are 2 neglected things that anybody can handle and take care of. You need real food. You got to get rid of junk food. You got to try to get rid of pesticides, artificial dyes and colors. I mean, just eat real food, vegetables, fruit, meat, fish if you can, and then get your sleep. Because if your sleep's out of order, you're probably going to have a lot of hard times. And then the final tip I'll give you is you got to fix the gut. Because there's a lot of gut-brain things going on, and anxiety is definitely related to those issues.
Eliezer Castillo, how old were you when you first started your job?
So I was 24 when I went to medical school, because I got a master's before I went to med school. That was 4 years, so 28 when I graduated from medical school. If you're talking about medical first job, that's the answer, 28, and then you do 3 years of residency, so 31 when I came out as a specialist in pediatrics. But my very first paid job well, other than mowing the lawn as a kid, was washing dishes in a Mexican restaurant in the Bay Area in California at the age of 15 or 16.
Josh Tavis asks, "Hi, Dr. Paul. This morning I had my blood drawn for the first time. About 2 hours ago, I fainted. Is this normal? And what is the best way to recover from it?"
So just just drink lots of fluids. You probably, if it's just a blood draw, it's just the stress of the whole thing that caused you to somehow probably get anxious about it. Drink lots of fluids and chill out, man. It's going to be okay.
Nope. Cool.
My producer's trying to give me tips, medical tips.
When I worked at Red Cross, volunteered, they'd always make sure everyone got juice and cookies.
Gotcha.
Right
So for Red Cross, they're going to give you a reward and some juice and cookies. It's the fluids that you need. You very rarely are passing out because you're low blood sugar. But I suppose a little bit of something that has a little boost of sugar might be good too.
Brian Torrens, what's your favorite color?
I'm a blue boy guy. I don't know. I love blue.
Serenity Vanover, how can I overcome OCD?
OCD, I would give you the same tip I gave for anxiety. So fix the gut, make sure you're getting enough sleep, and you know, there are doctor-approved treatments as far as pharmaceutical approaches, so don't ignore the option that if it's really severe and incapacitating your life, see a good doctor. But what you can do on your own is definitely clean up your diet, heal the gut, and yeah, that one is special. Maybe some counseling with somebody who knows how to deal with it. There are some tricks you can use to sort of move away from perseverating on those things that you're doing repeatedly.
Sebastian Michael says, "Hello, Dr. Paul. My foot's muscle is always pulled suddenly. How can I fix it?" Might be talking about cramping.
Well, if it's a muscle cramp, taking some magnesium can often help that. So I would say make sure you're taking a vitamin D supplement. None of us have adequate vitamin D unless you're a lifeguard out in the sun with your shirt off. And then you need a calcium magnesium supplement. That can often help the muscle cramps. If you've got an injury, it needs to heal. You know, you could see physical therapy, or you could do just simple massage. At CrossFit, they teach us how to use the rollers and the little ball. What kind of ball is that? Lacrosse ball, and just work on those tissues that are giving you trouble.
Hi, Dr. Paul. A question from It's Just Me 12_12305YT. Hi, Dr. Paul. My question is, what would you be if you weren't a doctor?
What would I be? That's an interesting question because there's so many factors, right? As a kid growing up, I'm around the church because my parents were missionaries. I thought I'd be a preacher. That wouldn't be it. I love driving. I could actually drive like it feels like forever. I love being behind the wheel, but that's not a healthy lifestyle, so I don't think I would choose that. I'm now an author and I really love that, so who knows? I might really pursue the author, speaker, that sort of a profession as my plan B.
Awesome. It's Just Daisy asks, what did you do after graduating from undergrad school or during school? Any advice for a sophomore in college? I want to become a pediatrician too. Perhaps she's talking about jobs? So
one of the things I did is I went and spent a couple weeks or a month with various professions. I went and spent some time with a dentist, with a physical therapist, a podiatrist. You know, I wasn't sure, was I going to make it to med school, for example, and if I didn't, what else would I do? I was pretty sure I wanted to be a doctor. So, you know, it's a good idea to just get some real life experience with the profession you might be getting into. And then beyond that, you know, become a well-rounded person. Pursue some things that you're passionate about.
Rob's AMV's question, what do you do about tight foreskin? He might be trolling, but it might be a legit question for infants.
So depending on the age, if you are pre-puberty, leave it alone. Okay, you don't need to do a thing. If you're an uncircumcised person, just leave it alone. When you go through puberty, the hormones all rise, estrogen, progesterone, testosterone, and everything loosens up. It'll probably be fine. So in those ages, leave it alone. If you're having trouble past puberty, you ought to have somebody take a look at that. Professional, obviously. Who actually is trying to go full time as a YouTuber. He's supporting himself by driving Uber because, you know, we just don't make enough money to support him. There's a lot of work that goes into editing videos. Obviously, this is just a live Q&A, but I'm not taking a penny from the channel at this point, and, you know, unless I lose my day job, probably won't need to. So it's just to support the work that we're doing on this channel, and I appreciate all of you who support our channel.
Stunted Bones 45. How do you get rid of mucus buildup in your nose?
Well, I would start with a saline flush. I used to buy a little bottle. I used to use a neti pot and just pour saline water through one side out the other, and it really helps clear it. Then I went to the little squeeze bottle. That worked really well. I happen to know from a fact, because I've done cultures, that I also had chronic staph infections in the past. I found something, silver, Argentin 23. I'm not getting any kickbacks from saying this. It just worked for me. It's a little spray of a very 23 parts per million silver solution, and it clears up the infection. So if you're suffering from infection, it'll help that. If it's allergies, that's another whole kettle, ball of wax, no, can of worms. You're going to have to figure out what you're allergic to, right, and avoid those things. But try the saline flush.
Gabrielle Davies just says, Dr. Paul, I've got a bump on my toe, and I don't know how I did it, and I can't touch it.
That could be a number of things. If it's a wart, it's going to stay and possibly start getting bigger, and you'll know, and then you can either do home remedies or have a doctor freeze it off. If it's a pimple, hopefully it doesn't get worse. It'll go away. Otherwise, yeah, have it checked out if it's not following a usual course.
Mini Mixies Q Universe. How do you get rid of / control acid reflux?
So acid reflux is when you eat a food, it hits your stomach, and your body naturally makes acid to help digest food. And we need acid in our stomach. It has a very important role of also keeping other stuff from lower down in the tract coming up into your stomach. But reflux is where that muscle is allowing food in the stomach to go back up. Actually, we know that if you have more acidic environment in the stomach, it helps close that sphincter, the gastroesophageal sphincter. I have a little bit of reflux. I burp easily if I drink a fermented drink. And for me, I just try to avoid doing that too often, because the more you do that, sometimes you'll irritate your esophagus. Smaller, more frequent feeds if you're talking about a baby with reflux, because the fuller the stomach, the more likely they are to spit up.
Katie Arnold says, I get sick like every week. How do I stop that?
Well, that's a real general question as far as being sick a lot. I would say, again, look at your diet. Are you eating real food? Lots and lots of nutrients that come from fruits and vegetables. That can help. And then somehow we got to boost your immune system. So you may need to make sure you're supplementing with vitamin D, fish oil, vitamin C, and there's other things.
Skull Crusher King, what happens if you stop drinking water?
Well, you're going to dehydrate, of course, and that would be extraordinarily dangerous if you weren't getting water out of your food. I mean, there are foods that are very high in water content. Think of a watermelon. You could get all the fluids you need from fruit, but in general, we need at least a little bit of water every day. In the U.S., we do a lot of water. I grew up in Africa, in Southern Africa, and we had a lady visit with us because we were helping her with her child who needed surgery, and she never drank. But I guess she came from an environment where good water was hard to find. So basically, your body can adapt to a very low intake of water. You just need a little bit to keep your kidneys going.
Blackwood Hoods, how do I stop my stools from being so loose?
So loose stools can be a number of things. If you're lactose intolerant, if you're an adult, I would say the number one problem is lactose intolerance. We were not designed to be breastfeeding, for example, past age 2, 3, 4, right? So if you're still drinking milk, taking a lot of dairy, you may not be digesting that sugar, the lactose, and it causes fluids to be retained in your GI tract, and so you've got loose stool. So that'd be problem number one. Try getting all the dairy out of your diet, especially milk, yogurt, and ice cream and milk especially. Secondly, you may have a number of other issues going on with the wrong bacterial makeup. Probiotics can help that. And of course, there's a long list. I can't possibly go over everything on this format. My producer says we got 15 minutes to go.
All right. Orpa Taveras says, is teenage depression normal?
So depression is always normal in the sense if you are feeling down about a circumstance that anybody would feel down about, right? If you've had a major loss, major trauma, you know, it is normal to not be all excited and upbeat and to be low and actually look clinically depressed. I think where it becomes a problem, and you'd have to say, well, is this normal or not, is when it's really knocking you out of your life. You're having a hard time with your normal daily activities. If you're feeling suicidal, that's definitely a red flag time to get help. Please talk to somebody. Don't be sitting in your own head if you're in that kind of trouble and pain. And Big No-No, actually, my producer, has a channel that he focuses on mental health as one of his big 3 or 4 topics that he covers, and that's BIGNOKNOW.
Gary Ridgway says, what is strep?
Streptococcus is a type of bacteria. When you hear about, oh, I had strep throat, that's Streptococcus viridans. Typically, there are many species of strep. Another common strep is strep pneumococcus, of which there are countless strains. There's a vaccine for strep pneumo that covers 13 strains. It's one of the leading causes of ear infections, pneumonia, blood infections, even meningitis if you're talking about strep pneumo. But most people, when they think of strep, they're thinking of the strep that causes strep throat. It's a bacteria.
Mr. Celery asks, why is aluminum bad?
So aluminum in and of itself is the 3rd most common element on the Earth's crust. So aluminum is not bad per se, it's in the Earth. However, it's important to note we have absolutely zero medical, biochemical, functional reason to use aluminum in our bodies. It has no purpose. Most elements, or at least a lot of them, are important for certain biochemistry reactions. Aluminum, once it's in your system, is quite toxic. It's one of the leading causes of autoimmune problems, as well as being directly toxic to the brain. Now, the confusion most people have is that if you have some aluminum by mouth, our GI tract is designed to keep that aluminum out of the body. So I think we absorb like 0.3%, some very small amount. If you inject it, for example, as part of a vaccine, now 100% is bypassing that mechanism and going into your body.
Sam Broyd just says, hi, Dr. Paul and Noah, greetings from the UK.
Hey, Sam. Good to have people checking in from around the world.
Herbie Oliver, how do I get rid of ulcers in the back of your throat?
So ulcers in the back of the throat are typically a viral infection. And again, the only thing you really can do is boost your immune system. So it hurts to eat or drink acid foods, so you want to avoid those. Cold liquids will feel the best, but to avoid them long term, it's all about boosting your immune system. Extra vitamin D if you need it, lots and lots of real food, fruits and vegetables.
Mia Watnick says, please answer my urgent question. Hi, Dr. Paul. Yesterday I had HPV dose 2. I'm really tired and irritable. Is that normal? And do you know anything about tarsal coalition?
I don't know about the last thing because I'm not recognizing that term, but HPV vaccine was never tested properly in terms of having true placebo, and the side effect profile for it is not good. If you're having a reaction, it's possible you're on the 2-dose schedule, so you're done anyway. But what I would do is not get a 3rd one if that was what was planned, because your body is telling you you're not responding well. The HPV is a very high-dose aluminum vaccine, and it's causing a lot of people trouble. So I'm sorry that you're experiencing that. For detoxing, aluminum can be detoxed by taking a little bit of silica. This is not a plug for Fuji water, but I was researching this for myself, and there's a couple super expensive waters on the market. And then the next one, as far as high content of silica, is Fuji. So maybe take some of that. Also take vitamin D, vitamin C, and anything you can do, a little bit of selenium in your multivitamin to help you get rid of toxins.
Perry Ion says, Dr. Paul, I'm taking my medical exam next month in Germany. Your videos motivate me, teach me, and inspire me. Any tips how to develop such a positive and caring way of handling young and old patients?
You know, somewhere along the line, I just learned this thing where if I smile at you, you smile back. It's magic. And there's a joy and an interaction that happens when you can just throw off a little bit of happiness. So practice it. right? I mean, it's genuine. I'm happy to see somebody. It's especially easy with babies, right? And they smile right back at you. They're so innocent. And so I think that's a big piece of it, is just learning to be happy with anybody that's in front of you, right? And in medicine, we're there to help people, which is just sort of inherently uplifting anyway.
S-Girl96, is staying on Adderall for life good or bad?
Well, I'd say neither. It depends. So if you have, for example, really, really severe focus challenges and impulsivity, and you take a medicine like Adderall, which is amphetamine, dexamphetamine, and if it truly calms you down and allows you to be functional, I've seen so many people for whom this is true, then, you know, it's probably worth the benefits, right, for that very minimal long-term side effect that really doesn't hit people until maybe they're old and they have heart disease anyway. On the other hand, if you can wean off of it, a lot of people through their teen years and early 20s can develop a manner of living where they're able to focus enough to live without it. I mean, I certainly was a little ADHD myself, pretty hyper kid, never had any medication. I learned to manage what I had, not always perfectly, but you give it your best.
About a Mother says, the tip of my son's penis is red quite regularly. Should I be concerned? He's uncircumcised, 2 years old. Gets better for a bit after baths.
So my boys are all uncircumcised.
How dare you?
Oh, sorry there, big no-no. Actually, when they were little, at that age, they also would get antibiotics too many times for horrible ear infections, and then would have yeast infections. So if it's the tip of the penis and you're uncircumcised that's sort of red and raw and irritated, it might be fungal. So I would try an antifungal cream and see if that helps, but otherwise just keep the area clean and dry.
Pamela P. asks, is it bad for my health to be taking an antibiotic for years in order to treat acne?
Oh, the antibiotics for acne question is troubling and difficult. Antibiotics are never good long term. When you have cystic acne, so it's really deep and it's going to be scarring, you know, there's nothing but antibiotics, or in some cases dermatologists will use Accutane to clear it up. So you have to do something. But I would say try to get off the antibiotics, try to manage your acne with topical preparations, eating real food, staying away from junk food. So if junk food, a lot of sugary in the diet, a lot of processed carbs, feeds the bacteria that cause acne.
I'm very curious to know how you will answer. Pro Archer 555, how do you grow a successful YouTube channel?
You get a good producer. So, you know, as you know, my son came to me and says, Dad, you've got a lot to share with the world. Let's get you on YouTube. And I was really reluctant. We just started. So the first thing is, if you've made a decision to give it a go, go for it. You definitely must be consistent. That is the most important thing. Put up at least 2 or 3 videos a week. I mean, when you're starting, if it's only 1 a week, then do 1 a week, but be consistent. And it takes time. So most YouTubers don't just strike it big to begin with. You might be months, you might be years, and it seems like nothing's happening, and then something does. But what we've been able to do with this channel that's helped, I think, is pay attention to what people are interested in. When you happen to put out a video that seems to have a lot more interest, pay attention. Well, why? And then build on that.
Hey, Mom. Mom! Someone said hi to. So SD Girl 96 says hi to your wife.
Oh,
someone's saying hi to you because you were in the background and you.
Oh,
I'm sorry.
You weren't able to be sneaky, huh?
Hi, you told me to stay in the back.
The woman behind the man.
You know what? I'm the magic behind both.
Oh my gosh, the magic, the magic. Just saying. There, you've heard it now, right there on YouTube. My secret's out.
Secret's out. Rishi DeBoer says, hi, Dr. Paul. Do you have any children? Yes, how old are they? Greetings from the Netherlands.
Well, greetings to you, Rishi, in the Netherlands. I have 9 or 10, depending on how you count. How can he not know how many kids he has? Well, there's actually a video, Meet My Family. It's one of the older ones. You got to look way back to find it, but they're all listed there. They range from age almost 21 to 34. Most are adopted, 3 biological. So 5 minutes, folks. Feel free to use that super chat.
And we can extend it. Insun Choi says, I love your channel and watch every day. You have the best doctor smile.
Ah, thank you.
The Challenge Bros say, notice me.
Challenge Bros.
You've been noticed.
You've been noticed.
Hey, Dr. Paul, how do you manage symptoms of vertigo? That's from rubber glue.
Rubber glue. Don't put rubber glue, no. Vertigo is that spinning sensation, and it is not easy to manage that, all right, because it could be an infection in the middle ear, inner ear region. It can be triggered by a number of things. There's viral infections. I wonder about various toxicities, sudden excessive loud noise. I would say if it's not going away, I would go get evaluated so a doctor can at least rule out all the easier things that can be taken care of.
Zoe Parker says, will my regimen of Epsom salt baths and baking soda poultice, P-O-U-L-T-I-C-E-S, whatever, help work out the item that is stuck under the skin of my foot?
So, you know, when you have a foreign body in your foot, it will usually eventually fester and work its way out. So the Epsom salt baths are adding some I believe it's magnesium there. It can't hurt. I think just warm water would also work.
W. Dunderdog asks, how do you keep from getting sick from your patients?
So this is like a really cool question because, folks, what keeps us healthy? Seriously, what keeps us healthy?
Love.
Love is a good thing because that helps our immune system. It's your immune system. And what supports the immune system? You want to avoid stress. You want to get your, excuse me, get your nutrients. And sometimes you got to take supplements if you're deficient in certain nutrients. Everybody needs extra D. But, you know, almost all doctors, pediatricians, nurses starting to work in pediatrics are sick for the first 2 or 3 winters because you're exposed to so many things your body's never seen. And then you just get to the point where your immune system has seen most of these things and we don't get sick anymore. I mean, I've had measles, mumps, rubella, strep, you name it.
Aiden O'Connor. Hello, Dr. Paul. I'm from Ireland.
Hi, Aiden.
And when I was a couple weeks old, I had meningitis. And I was wondering, what are the main causes of meningitis?
So meningitis can be viral or bacterial. Sure, there's super rare fungal meningitis if you're immunocompromised, but it's usually a bacteria or a virus. The bacterial meningitis tends to be more serious, but it's treatable with antibiotics. The viral kind, it just has to run its course. And what it is an inflammation of the lining around the brain. And, you know, infection around the brain obviously is not a good thing.
Got it for a super chat.
Thanks for the super chat.
Keller Cult.
Keller Cult, appreciate the support.
Hi, Dr. Paul from Keller Cult. Here in Austria, vaccine against tick-borne encephalitis is an issue. What's your opinion on this vaccine?
Well, you would go and ask the really hard question because I don't know exactly which vaccine you're talking about. With any vaccine, I think you need to assess the risks and the benefits and the alternatives. So one of the alternatives for any vaccine or any medical procedure is not to do it, but you've got to analyze the risks, right? If this tick-borne encephalitis is rampant and people are coming down with it all over the place and the vaccine is working, you're going to do it, right? If it's really, really rare and the vaccine has a lot of side effects, you're going to have to think twice. At this point, I don't have enough information beyond that to advise you, but it was a great question.
The Cheshire Cat, what is the weirdest reason someone has come into your office?
Weirdest reason? Oh my goodness. I mean, we have things in noses and ears, bugs, beads, Lego blocks. That's kids, right? I don't really think that's not that weird for kids. Oh dear, weird. I'm not good at these questions. I'm going to have to think on that one. Maybe at another episode I'll come out with what was weird.
Brianna Wilson says, what do you do if you feel like you're anemic? My hands and feet are always cold and I wear a jacket all year long. Please.
So having cold hands and feet may have nothing to do with anemia. So get your blood work checked. Hemoglobin or hematocrit will answer that question, whether if you're anemic. Most cases of anemia are iron deficiency, so you need to replace iron. You can get it from your food. Red meat is highest in iron, but you can get some from the dark green leafy vegetables. And but if it's not from anemia, that's a whole different issue with circulation, and that's a complex, rare list of possibilities. See a doctor.
Jeffrey Wong asks, thoughts about vaping?
So vaping is this new thing that's hitting the United States big time, right? So you're not smoking a cigarette, you're smoking, I guess you could hold it either way. You're smoking this electronic, battery operated, I believe, thing where you put some oil. It can have nicotine, it can have other things, and it's safer than cigarettes in the sense that you're not getting all the tar and other toxins that come from burning leaves. There's a large methanol release when you burn plant material. That's really bad for you. And I think there are a lot more carcinogens. So in that regard, it's safer. But the jury's still out, because there are some other chemicals that arise from that whole process of vaping. So drink water, that's a good thing.
Happy Ian. Dr. Paul, what can I do about anxiety without taking medications?
So anxiety, if you can identify your triggers, this would be important so you can avoid anxiety-provoking situations if they're avoidable. Obviously, a lot of things that we're anxious about we can't avoid, whether it's people or work or school or whatever, stress. But minimizing stress, get your sleep, get your nutrition. I keep coming back to that. It's critical for our health, especially brain health.
Ethan Millwood, what is the most amount of melatonin the body can handle?
So for an adult, I think it's rare that you should go over 10 milligrams, and if you can get by with less than that, this would be good. I was at one conference where there was a medical doctor who said the same thing. Generally 10 milligrams is the max, but he also confided with the entire audience that he used 20. So I really don't think you should go over that. The melatonin is made in the pineal gland in our brain. Anytime you take an external source of something your body makes, you suppress your natural production of that substance. So you're shutting off your own pineal gland. I happen to think melatonin is a useful tool to help folks who can't get to sleep, but be cautious on the dose.
Crystal Munoz, how do you deal with mainstream doctors who do not agree with your research and your findings?
Oh, that's the big one.
Good personal question.
It's a great question. The problem I have is that most of the mainstream doctors who, let's just take, for example, vaccines. I'm not anti, I'm not pro. I think we need safer vaccines. We need really safer vaccines. And some of them on the current CDC schedule make no sense at all. And I'm always baffled by why, I mean, hepatitis B for newborns, why other doctors can't see that, can't figure that out. So they look down their nose at me like I'm nuts, and I just have to, like, whatever. They just don't seem to know what they don't know. And sadly, they don't seem to be interested in learning what I've learned, because the more you research it, doctors who actually take the time to really do the research themselves, not just take the sound bites that they're being fed, you're going to learn something that makes you start questioning the status quo. I don't know if I answered that question, though. I dodged it a little bit.
We're almost done. Kristen Klausel says, how does Ebola affect the body?
Ebola?
Yeah.
Well, from what I've read, if you have a serious infection with Ebola, it really blasts your whole body's mechanisms for fighting infection, and you're just going to have what we call sepsis or bleed out. It's a harsh infection. Interestingly enough, people in West Africa, where they were at the epicenter of the Ebola epidemics, some people were surviving and doing just fine, but that one was a high fatality rate.
Ali Meisner, what to do for heat-related hives?
Heat-related hives. I have a
5-minute warning.
5-minute warning. I have a employee who has that very issue. So some people are very prone to releasing histamine, which can then cause hives, and it can be triggered by things like heat, things like stress, things like smell. Some people are super allergic to perfumes. I think what you've got to do is do things that will downregulate your immune system at that level, the histamine release. So, I mean, there are over-the-counter things like Claritin or Loratadine, Zyrtec. I think there's some natural things. Turmeric is good. Fish oil is good. These are things that help balance the immune system. And I got a super chat to acknowledge.
I didn't mean to cut you off, sorry.
Yeah, we're good. I was there.
Okay, so Babuslav Kretoshopslav did a $10 super chat.
Wow, thank you.
He said thank you for your videos.
Wow, appreciate the support. That's one less hour Big No-No is going to be on the road.
Rhonda Rumble, how has YouTube been positive for you?
So, I actually enjoy being able to share things that people maybe aren't getting elsewhere. So, you know, mainstream, our media is dominated by a storyline. And if you want to veer from that storyline, even if what you have to share is truth, you sometimes can't get to your audience. So I think YouTube and social media in general has blown that up and allowed us to have this conversation and talk about things that really matter for your health. And that's, you know, I'm a doctor, I'm a pediatrician, I'm an integrative medicine doctor, I'm an addictionologist. These are all areas that interest me so that we can get people, take ownership of your own health and quit relying on doctors who are basically, sadly, too many times just writing prescriptions.
Amelia Cup asks, what causes blackheads and how do you get rid of them?
So blackheads are those sweat glands on your nose that get clogged, and you know, if there's a little bit of dirt and it's clogged, you've got yourself a blackhead. We're told to teach not to do the expression like that. They have those strips where you can try to pull them out. I think those are safer. Anything that sort of irritates the tissue, we call it exfoliation, that can work as well. So it allows new skin to rise to the surface and can have that beautiful skin again.
Zucker, the Kazus kid friend, hi from Latvia. Oh, and why can I have dislocated elbow very easily?
So dislocated elbow is the radius which runs along the thumb side of your arm, coming out of the band right here that holds it at the elbow. And it's usually a pulling motion that can pop that out. I've almost never seen that past age 5 or 6. So probably yours got dislocated so many times that that band has been stretched to the point where obviously it keeps dislocating. Avoid that mechanism that causes the dislocation. Build up the muscles that strengthen that joint. And if it still happens and you're an adult and it's happening all the time, you're probably going to need surgery.
Kat Turner says, Dr. Paul, how can I tell if my son has Down syndrome?
Well, the appearance, just looking at a kid with Down syndrome, they often have just one crease here. That's called simian crease. Their toes, big toes might be wider spaced. Their eyes are a little more slant. They usually have a thick tongue. There's sort of that look. I'm sure you've seen that you can Google that and see the pictures of what Down's looks like. But really, you just get a blood test and get the answer. It's very simple now to identify in a simple blood test if you have Down's or not.
2 minutes.
2-minute warning, folks. And I wish you all a happy Labor Day, too. Hopefully, if you're in the storm areas, oh my gosh, what Houston's been through, our hearts go out to all the folks there who are suffering and those who've lost lives. That's just so tragic. Watching this on television is just like unbelievable. So, you know, our hearts and prayers are with all of you who are still in the suffering of that storm.
This is a silly one to follow up on a very important thing you just said, and I think it's going to be really funny. XXVELPRAXX says, can you dab? So this is how you dab, Dad.
This is how you dab?
You put the other hand up.
Oh, like so?
Yep.
I guess now I can dab. I learned a new trick today. See the amazing thing about YouTube. You can even teach an old doctor.
He got it.
Can I do it both ways?
But you gotta bury your.
Oh, you gotta bury it.
There we go.
Gotta really dab. Oh my gosh. Never heard of that.
Dr. Dabman, they're gonna call you now. Is what someone said.
That's hilarious.
That's pretty funny.
Thank you for that question. You gotta add a little humor sometimes, right?
Everyone's freaking out about that. Let's find the last question of the day.
All right. Last question, unless you guys throw up some, what are those called?
Super chats.
Super chats.
Yeah,
okay.
So some super chats will keep this.
You can keep me on here with super chats, but otherwise, we're going to take one more question.
Okay, let's see. What's a good last question.
While you're looking, I'm going to tell you a story that I was at CrossFit this morning. Well, it was late morning. We had a new member. Actually, she was just visiting. And she's a speech therapist specializing in autism. And she works in one of the local schools here. So I said, well, what's the age range at your school? Kindergarten to 6th grade. I said, how many kids are in your school? There's about 400. I said, well, how many kids are you working with? She says, well, I'm working with over 50 kids who have language disorders and autism. I'm thinking 50 kids. Well, it was 300. 300 kids in her school. 50 kids have problems. That's 1 in 6, folks. 1 in 6 kids. That's not normal. And this is the story I'm getting over and over and over again. If you're blessed with a healthy kid, well, God bless you. That's awesome. But too many kids are suffering. We need to start paying attention to that. All right, off your soapbox. Did I use it inappropriately?
The dab is like you say something you believe in and you dab on it.
Oh, and you... Okay.
God, what have I started?
Uh-oh. I'm going to have to practice this, though. It's awkward.
So we've got a question from a young viewer that we're going to go ahead and call our last one, barring a big super chat comes through. But Lewis Farrell, he says, hi, Dr. Paul.
Hey,
I'm
Lewis.
11 years old, and I'm from Liverpool. And I have irritable bowel syndrome, and I have been taking Movicol, I'm not sure if you know what that is, for over 5 years. And I would like to know what else could I use instead of Movicol.
All right. So irritable bowel syndrome, the way I would approach it, if this hasn't been done already, is you've got to think about drastic changes to your diet, because sometimes reworking the gut will solve irritable bowel. So there's a book, you're in Liverpool, so you're in England, The GAPS Diet. That is an English author, amazing book. It's a tough diet to do, but you're getting old enough that you might be motivated because you've been struggling, right, enough. So get that book, The GAPS Diet, GAPS, Gut Associated Psychology Syndrome is what that stands for. And I would start there. But when you can eat a lot of fermented foods and reset your gut, you might find that, along with avoiding the foods that trigger problems, that you can heal from irritable bowel.
Jonathan Aquino just gave us a $2 super chat.
Hey, Jonathan.
We're going to honor that by
absolutely.
extending
We'll keep
the
going.
Q&A.
If you keep giving me super chats, I can keep this guy off the road.
Jonathan Aquino says, hello, Dr. Paul, from Vancouver. What is your opinion on bleach baths for treating severe eczema? Okay.
So that's actually a trick I learned from one of the infectious disease experts that I admired the most. Dr. Paisley taught at Children's in Denver, moved to Portland, and we taught and medical students and residents together before I went out into private practice. He was the smartest doc I've ever known, and also a lot of common sense, which I really loved. He's since retired, but shout out to Dr. Paisley, amazing doc. What he said, and this is now published in the literature, the problem with eczema and the reason sometimes it gets so out of control is it also gets infected. When you break the skin barrier with your allergies or sensitivities or whatever's triggering that rash, now bacteria can infect your rash, and the bleach bath is take about a quarter, no more than a half cup in a full tub of water and just soak in it for 5-10 minutes and do that once a week. Bleach, they used it against Ebola in Africa. You saw the people just spraying it everywhere. It kills bacteria very effectively. Don't get it in your eyes, your mouth, mucous membranes. Avoid that and rinse off really good afterwards. But that kills the staph or whatever bacteria infecting your eczema and allows your skin a chance to heal.
I think we're done.
All right, folks. I want to thank you for watching. I'm Dr. Paul, and we're going to try to do this once a week for you, and I appreciate your support. Again, thanks for watching.
We're saying bye. 3, 2, 1, and...